Good evening to all. Myself Priyanka. I am working as a community health officer in Health and Wellness Center. So today topic of discussion is Integrated Child Development Scheme, that is ICDS. So as the name suggests that this scheme is related to the children, and we provide the one or more services to the children. That's why here we use the word integrated. Okay, and the children which we considered under this scheme is 0 to 6 years age group children. So when was the integrated child development services has been launched? So it has been launched in 1975, and the main purpose of launching these services to provide the and to promote the comprehensive development of the children. Comprehensive development means we must focus on the all over development like physical, mental, social development of the children as well as the mother, and to prevent the children from the challenges like malnutrition. Later on, I will tell you that how we can prevent a children from malnutrition by taking care of an antenatal mother as well as the postnatal mother. So, next is the objectives. So, what are the objectives of this scheme? The first objective is to improve the nutritional and the health status of a children whose age group is between 0 to 6 years. I told you prior that in this scheme we must focus on the age group of children between 0 to 6 year. So, what is our first objective? We have to improve the nutritional status and the health status of a children whose age group between 0 to 6 year. That is the first objective. Second one is the we must focus on the, as I told you in the introduction, that we must focus on the comprehensive development of the children. So we must focus on the comprehensive means all over development, like we must focus on physical, psychological as well as the social development of a children whose age group is between 0 to 6 year. Next is the our main purpose behind to provide ICDS services so that we can reduce the incidence of the mortality, morbidity, and the malnutrition and school dropout. Okay, mortality means we reduce the death rate of children, we reduce the disease rate of a children, that is the morbidity, and we reduce the malnutrition, protein energy malnutrition, that the children is mostly suffer from kwashiorkor and marasmus if don't get adequate nutrition, and we reduce the school dropout. Okay, next is the to achieve effective coordination of policy and implementation amongst the various departments to promote child development. Okay, so with ICDS services, other policies are also work along with the ICDS. So the services that has to be provided, that should be properly implemented to the children so that we can promote the proper health status of a children. And the last objective is to enhance the capability of the mother to look after the normal health and nutritional need of the child through proper nutrition and health education. So, at primary level, what the health workers and as a CHO I can do, I can provide the awareness provided through the health education. That is the main objective of the health workers that work at the primary level. So, through health education, we educate the people about the nutritional status, what type of nutrition the antenatal mother can take, and what type of nutrition they provide the children after delivery, and we also educate the mother about the exclusive breastfeeding, and why the colostrum is important, and the after 6 months start weaning. All type of awareness I provided to the mother so that their children will be healthy. Okay, so all the awareness provided by the health workers at the primary level, and at primary level which health workers can work, like a CHO, community health officer, female health workers. Okay, So that's all about the objectives. Now we are moving towards the beneficiaries and services in ICDS. So what are the beneficiaries? What is beneficiaries? Beneficiaries are those who can take the services from us. ओके जो सर्विसेज ले रहे हैं वो क्या है, बेनिफिशरीज हैं. सो व्हाट आर द बेनिफिशरीज under ICDS? So the children whose age group is less than 3 years are the beneficiaries. Adolescent girls are the beneficiaries. Lactating women are the beneficiaries. Okay, जो अपने बच्चों को ब्रेस्ट फीड करवा रही हैं, these women are also beneficiaries. Children in the age group of 3 to 6 years are beneficiaries. Pregnant women are beneficiaries, and women in the reproductive age groups are also the beneficiaries under the ICDS. So there are 6 beneficiaries that comes under the ICDS. Okay. Normally, how you can learn the beneficiaries? I told you prior that the children whose age group is between 0 to 6 years are comes under the ICDS. So two beneficiaries are children whose age is less than 3 year, and the second one is the children in the age group of 3 to 6 year. And I also told you prior that we focused on the antenatal mothers. So the pregnant woman is also our beneficiaries, and we must focus on the reproductive age group, that is the 15 to 45 years age group that we consider as a reproductive age group. Lactating woman, postnatal mother is also the beneficiaries, and the adolescent girl. Okay, adolescent period is 10 years to 19 years period. So these all are the beneficiaries. So first beneficiary is the children less than 3 years. So the children whose age is less than 3 years, we must focus on their supplementary nutrition. We must focus on their immunization, health checkups, and the referral services. Okay. So at the primary level, as a CHO, what I can do, I must provide the awareness to the mother regarding the nutritional, how the mother can maintain the nutritional status of her children. I aware the mother regarding this. Okay. And I must focus on the immunization. So at the time of birth, you know that BCG, OPB, and hepatitis V, they give to the children. And after that, we give Penta 1, then OPB, okay, Rota, then IPV and PCB. After that, we give Penta 2, Rota, and polio. After that, after that we give Penta 3, OPB, Rota, IPB, second dose, and then PCB, second dose. Okay. After 9 months, we give MR first. Okay. And after 15 months, we give MR2, then DPT booster, and the polio booster dose. So these all are the vaccines we give to the children at the primary level in the health and wellness center. So we must focus on that, and we can do the proper health checkup of the child. So after birth, we can do, if there is an institutional delivery, then we can do 6 postnatal visit and the infant visits. At that visit, we can do the proper height and weight of the children. Height तो आप एक बार ही लोगे, then every visit you can check the weight of the children. Okay. Through this you can understand that what is the health level of the children and how is the health status of the children. Okay. And then you also provide the referral services to the children. Okay. Then after 6 months, you start the weaning. Educate the mother to start the weaning. You educate the mother that what is weaning. Okay. After that, also give for deworming, you can give albendazole to the children. The children whose age group is less than 2 years, you can give half tablet of albendazole, that is 200 mg. Okay. And after 2 years, you can give the full tablet, that is of 400 mg. ओके. तो ये सारी बेसिक चीज़ें हैं जो आप प्राइमरी लेवल पे मेंटेन कर सकते हो. नेक्स्ट इज द एडोलोसेंट गर्ल. सो एडोलोसेंट गर्ल के लिए यू मस्ट फोकस ऑन द सप्लीमेंट्री न्यूट्रिशन एंड प्रोवाइड द अवेयरनेस टू द एडोलोसेंट गर्ल. एंड द लैक्टेटिंग वुमेन, you do proper health checkup of the lactating women, that I told you that lactating women कौन सी होगी, जो postnatal होंगी. ठीक है. those all are the lactating. So you must focus on their health checkup. postnatal visit आप पूरे करोगे. अगर institutional delivery होती है तो आप 6 postnatal visits करोगे, and if there is an home delivery so you can do the 7th postnatal visit. Okay, and you also focus on the mother supplementary nutrition and health education give to the mother, that she so health education, what type of health education you can give to the lactating woman. So the main health education as a CHO you can give to the lactating woman, that she must has to take iron and calcium after delivery for 180 days. Okay, that type of health education you also give to the lactating woman. Next is the children in the age group of 3 to 6 years. So in addition to the above services, non formal education is provided to the children. ठीक है. So आंगनवाड़ी सेंटर्स में चिल्ड्रन जाते हैं, ठीक है, वहाँ पे नॉन फॉर्मल एजुकेशन जो वो चिल्ड्रन को प्रोवाइड की जाती है, ठीक है, और सप्लीमेंट्री न्यूट्रिशन भी मिलती है. प्रेग्नेंट वुमेन्स का you have to do proper antenatal visits of the pregnant woman, that is of 4 antenatal visits you must do. Okay, first visit is up to 12 weeks, after that after 12 weeks, okay, then third visit, and then fourth visit. Okay, there is a specific period for the visit, so under that periods you can do the 4 antenatal visit of a woman. And at the first trimester, that is of 12 week, you can give folic acid to the woman. Okay, and after 12 weeks you can give albendazole to the woman, and iron and folic acid and calcium. Okay, iron and folic acid आप क्या करोगे, 1 tablet you have to give, and per day, and calcium you educate the pregnant woman to take 2 tablet of the calcium per day after first trimester. Okay, and after delivery you also educate the woman to take iron and folic acid and calcium for 180 days. Okay, so that type of health education you can give to the pregnant woman, and do proper health checkup at their antenatal visits. Okay, and immunization you can क्या इम्यूनाइजेशन आप दोगे, TD लगाओगे. ओके, TD फर्स्ट एंड TD 2, एंड इफ द प्रेग्नेंट वुमेन इज मल्टी, एंड मतलब वो फिर से बिफोर 3 years जो है, जैसे फर्स्ट बेबी है उसका, और फिर से वो विद इन 1 year प्रेग्नेंट हो गई. आफ्टर 3 years अगर प्रेग्नेंट होती है, देन यू कैन गिव TD 1 एंड TD 2 बोथ. बट बिफोर 3 years जो है वो प्रेग्नेंट होती है फर्स्ट बेबी के बाद, तो यू कैन गिव TD बूस्टर टू द प्रेग्नेंट वुमेन, एंड ऑल्सो गिव अवेयरनेस टू द प्रेग्नेंट वुमेन रिगार्डिंग द सप्लीमेंट्री न्यूट्रिशन एंड हेल्थ एजुकेशन. तो अवेयरनेस ही है. ठीक है. नेक्स्ट इज द वुमेन इन द रिप्रोडक्टिव एज ग्रुप, दैट इज आई टोल्ड यू दैट रिप्रोडक्टिव एज ग्रुप इज अप टू 18 to 45 years. सो इन दैट एज ग्रुप वुमेन you must provide them awareness regarding the nutrition. Okay, so these 6 are the beneficiaries that comes under the ICDS program. Clear? Now I teach you regarding the services that comes under the ICDS program. These all are the beneficiaries. Clear? Now we focus on the services. So under ICDS program, so delivery of services under ICDS, what type of services we provide? We focus on the supplementary nutrition. Okay, second we focus on the immunization, third we focus on the preschool education, and next is the health checkup, then health and nutrition education and referral services. So these 6 are the services that we provided under the ICDS program. Okay, all the services we studied prior, like supplementary nutrition. Why the supplementary nutrition is why we educate the women or children regarding the supplementary nutrition? If they are not get adequate amount of nutrition, then they face the challenge of malnutrition, protein energy malnutrition. So under protein energy malnutrition there are 2 type of malnutrition, that is the kwashiorkor and marasmus. Okay, And if the child is having malnutrition, then obviously the school dropout is increases, and that affect their study also. Okay, so supplementary nutrition, we include the supplementary feeding and growth monitoring. We have to do proper growth monitoring of the child, and prophylaxis against the vitamin A deficiency and control of the nutritional anemia. We focused on these. Okay, then the nutritional supplement is also provided at the Anganwadi centers. Okay, and children below 3 years, pregnant and lactating women are provided to take home rations. And ICDS scheme is universal and eligible irrespective to the economic status, eligible for all ICDS scheme. Okay, supplementary nutrition is provided for the 300 days per year, and the weighing weight of the children has been done monthly. Supplementary nutrition की guidelines क्या है? There are three subtypes. First one is the children with first degree malnutrition, so we must focus on their nutritional education and also provide health education to the women. And the second and third degree malnutrition, we must focus on the supplementary nutrition. And fourth degree malnutrition need hospitalization. Okay, next is the immunization that I already told you. Preschool education, so we provide preschool education to the children whose age group is between the 3 to 6 years. And preschool education, that is the non-formal education provided at the Anganwadi centers. Okay, and one Anganwadi centers in every village with 1000 population. And why the preschool education is important? The preschool education is important to change the attitude of the children, to change the point of view of the children, and to change the behavior of the children. ठीक है, and in Anganwadi centers there are also toys that the children mostly use for playing and all the things. Next is the health checkup. Sorry. So under health checkup, we must focus on the antenatal women health checkup, postnatal women health checkup, and the care of children under 6 years of age. We must focus on the immunization, iron and folic acid, along with protein supplements. And antenatal visit is important. Physical examination of the mother is important, as well as the child is important. Then the mother who is at a high risk. ओके, हाई रिस्क मदर्स कौन सी होती हैं? जैसे मान लो किसी की प्रेगनेंसी जो वो 18 ईयर्स में हो रही है, या अबव 30 ईयर्स प्रेग्नेंट है कोई वुमेन whose age is above 30 years, so we consider these women under a high risk pregnancy. या फिर पहले जिसका अबॉर्शन हो चुका है, कंसीव करने के बाद एक बार दो बार अबॉर्ट हो चुका है, तो उन्हें भी हम लोग क्या करते हैं, हाई रिस्क प्रेगनेंसी में कंसीडर करते हैं. Okay, so we provide the referral services to the high risk mothers and care to children below 6 years of age. What type of care we are providing to the children? We measuring the weight of the children, deworming, albendazole आप दे सकते हो. We must focus on the immunization, referral services to the hospital, ठीक है, general checkup and to screen the patient for the diseases, and health card to mother and child. ओके, इम्यूनाइजेशन कार्ड हम लोग बनाते हैं ना, MCH कार्ड जो हम लोग बनाते हैं एट द प्राइमरी लेवल ऑफ अ एंटीनेटल वुमेन. तो उसमें प्रॉपर सब कुछ होता है, ठीक है. उनके सारे विजिट्स हम लोग ऐड करते हैं. कब अगर हमने उन्हें कोई TD1 लगाया, TD2 लगाया, TD बूस्टर लगाया, उसकी एंट्री हम लोग उसमें करते हैं. वी ऑल्सो एंटर्ड अबाउट द एल्वेंडाजोल. ओके, एंड आफ्टर डिलीवरी we also entered about the child immunization. Okay, so that's all the needful information are written in the card जो कि women जो है वो read कर सकती हैं. Okay, then the referral services. So I told you prior that the child who is sick, you can provide the referral services to the patient. refer करोगे आप उसे higher health centers से. Okay, so from health and wellness center I refer to from health and wellness center to the PHC level, and PHC will refer to the CHC level, and CHC will refer to the district hospital level. Okay, so that is the referral services provided at the primary level. So these all are the services. So the what is main in ICDS, the main, up to this point, the main thing is, first, when was launched? So launched in 1975. Okay, and we must focus on the age group between 0 to 6 year. And what are the beneficiaries under ICDS? There are 6 beneficiaries that we studied. And what are the services that provided under the ICDS? Like supplementary nutrition, second one is the immunization, third one is the preschooler education that provided at the Anganwadi centers, next is the health checkup, then the health and nutritional education, and the referral services. So there are 6 beneficiaries in ICDS, and there are 6 services provided under the ICDS. So these all things are important from the entrance point of view. Now we are moving towards the next thing, that is the scheme for adolescent. So what are the schemes for the adolescent? So there are 2 schemes for the adolescent, that is the Kisori Shakti Yojana, and second one is the nutritional program for the adolescent girls. So the what is Kisori Shakti Yojana? The program addresses the nutrition and health and developmental needs, literacy and numerical skills of girls between 11 to 18 years. Okay, so किशोरी शक्ति योजना में मेनली फोकस किया गया था. Okay, this योजना is mainly address the nutrition of the adolescent girl, must focus on the developmental need, their education, okay, and their skills. And nutritional program for adolescent girl. This program was initiated in which year? 2009 to 2010. And this is the pilot project. Pilot means small scale पे ये project था, ठीक है, and implemented in the 51 districts of a major states. सिर्फ 51 districts में इस प्रोजेक्ट को क्या किया गया था? इम्प्लीमेंट किया गया था. किसके लिए? फॉर एडोलेसेंट गर्ल के लिए. ठीक है, कौन से ईयर में इनिशिएट हुआ था? 2009 to 2010. And the aims of this scheme of adolescent are, okay, so this scheme for the adolescent girl. So what are the aims? To improve the nutrition as well as the health status of the adolescent girl. ठीक है, to provide the effective nutrition as well as health education to the adolescent, and to empower the adolescent girl to care of their personal health as well as the nutritional need. And how we can empower the adolescent girl? By providing the awareness regarding the education, okay, regarding the nutrition. So from those things we can empower the girl. Okay, next is the role of Anganwadi workers. So Anganwadi workers deliver the services under the ICDS. ठीक है, so what is the function of the Anganwadi workers? She is the multi-purpose agent, work close with the community. Obviously, the Anganwadi worker work at the community level, at the primary level. Direct link with the children as well as the mother. ठीक है, and Anganwadi workers can do the survey in the community and assist the beneficiaries also. Beneficiaries are who are the beneficiaries? Mother and children. And organizing the non-formal education, as I told you prior, that non-formal education given to the children whose age group is between 3 to 6 years at the Anganwadi centers. So who can provide the non-formal education? That is the Anganwadi workers. And she also provide the nutrition as well as the health education to the mother. And Anganwadi centers में mostly जो है डेज BHSNC डे जो है सेलिब्रेट किया जाता है. ठीक है, विलेज हेल्थ सैनिटेशन एंड न्यूट्रिशन डे, in which the Anganwadi workers can educate the mothers. And Anganwadi workers can also assist the primary health center staff in provision of health services, and maintain record like immunization, feeding and attendance. Okay, how they can assist the PHC staff? PHC स्टाफ को कैसे असिस्ट करती है? जैसे कोई भी IPPI स्टार्ट हो रहा है, ठीक है, इंटेंसिफाइड पल्स पोलियो प्रोग्राम जो है, ठीक है, अगर वो स्टार्ट हो रहा है तो उसमें आंगनवाड़ी वर्कर्स जो हैं वो हेल्प करती हैं, ठीक है, पीएचसी स्टाफ की, या प्रॉपर रिकॉर्ड मेंटेन करती हैं रिगार्डिंग द चाइल्ड इम्यूनाइजेशन, फीडिंग। ओके, तो उसमें वो पीएचसी लेवल पे पीएचसी को क्या करती हैं, असिस्ट करती हैं पीएचसी स्टाफ को। तो जो भी आंगनवाड़ी वर्कर्स, लाइक आंगनवाड़ी वर्कर्स, आशा वर्कर्स, कम्युनिटी हेल्थ ऑफिसर, फीमेल हेल्थ वर्कर्स, MOPHC, supervisors, pharmacists, these all are comes under the primary level. So they all are have a they all have a direct link with the community, so they can provide effective services at the community level. And one more thing I want to say, if the mother and child get effective services at the primary level, then there is no need to go at the tertiary level. Okay, and there is and the child is not facing any problems like malnutrition if the health worker can properly educate the mother at the primary level regarding the supplementary nutrition, as well as the regarding antenatal visit, and if the health worker can do a proper antenatal checkup, then the woman have a safe pregnancy, safe delivery period, and the child is also healthy, and child weight is at a adequate level. There is a no weight is less than no child whose weight is less than 2500 gram. Okay, so that's all about the ICDS program. I hope you understand the program very well. Thank you friends, and have a good day.